All right, let's talk about healthcare, but probably not in the way you're used to thinking about it. See, we're not just going to complain or list a bunch of problems. Instead, we're going to dig deep, break down the core design flaws of the modern system, and actually explore a real blueprint for fixing it, for building something better. So, you ready? Let's jump in.
Okay, so it really all starts with this huge paradox. It's a question that just doesn't seem to make sense. How is it possible that the world's richest country can pour more money into healthcare than literally anyone else, and yet have its people live shorter, sicker lives than folks in other developed nations? And we're not talking about a small gap here. It's a chasm, a huge one. And figuring out why that is, well, that's the key to unlocking this whole thing.
I mean, just look at these numbers. You don't need much more than this chart to get it. It really tells the story. The US is spending almost $13,000 per person. That's nearly double what Germany spends, and it's more than double the UK. Just think about that for a second. And yet, on basically every important measure you can think of, life expectancy, chronic disease rates, it's falling behind. So this tells you right away, this is not a money problem. It's a design problem. All right, so here's the plan. Here's our blueprint for today. First, we'll nail down that core crisis of design. Then, we're going to walk through count them, four key pillars for a better system. We're talking about how we pay for care, how we use tech the smart way, how we fix the insane drug market, and why mental health has to be part of the main conversation. And then at the end, we'll talk about the big one. What's it going to take to actually make this happen? Okay, first things first, the foundation of the problem. It's so important to get this straight. This isn't about bad doctors or bad nurses. They're working incredibly hard. No, this is a crisis that's literally baked into the system's DNA. The problem is the rulebook itself, the very logic that drives how we deliver and pay for care.
And that brings us to this absolutely crucial idea: misaligned incentives. What does that mean? It means our system right now is basically built to make money from people being sick. It rewards activity, more tests, more procedures, more appointments. It doesn't matter if you get better, it just rewards doing stuff. The actual goal, making people healthy and keeping them that way, well, that's not what gets rewarded. It's a system that turns vulnerability into a profit center instead of one that cultivates wellness. It's completely backward. For as long as I can remember, the whole debate has been stuck on this one track: public versus private, government versus companies. But when you look at what actually works around the world, you realize that's the wrong question entirely. It's a distraction. The real goal, the thing that matters, is a universal guarantee of care. Simple as that. Everybody's in, nobody's out, period. And once you have that guarantee, sure, you can have a mix of public and private providers, but here's the catch. They all have to play by the same set of fair, transparent rules that put the patient, not the profit, first. So that brings us to our first pillar of reform. And this one gets right to the heart of those messed up incentives we were just talking about. It's all about how we pay for things. Because think about it, if you change how the money flows, you change everything. The entire behavior of the system shifts. And this right here, this shows you the two completely opposite ways of thinking about it. On one side, you've got fee for service. This is the old way. It pays for quantity. The more procedures, the more tests, the more you do to a patient, the more money you make. It doesn't matter if the patient actually gets healthier. Then on the other side, you have value-based care. And this model pays for quality, for good outcomes. So for example, a hospital might get a single bundled payment for a successful knee replacement, and that includes the follow-up care and recovery. The incentive is to do it right the first time and help the patient heal. You see how that one little shift completely flips the entire logic of the system on its head?
All right, pillar number 2. We've got all this amazing technology now, right? Stuff like AI. The huge question is, how do we use it to make healthcare better and more human instead of just colder and more robotic? And the answer, the core principle, has to be this: clinical augmentation, not clinical replacement. The goal should never be to have some algorithm replace a doctor's judgment or empathy. No, the goal is to give that doctor an incredibly powerful assistant. Think of it like a second layer of perception that can spot tiny patterns in an X-ray or flag risks that even the best human eye might miss.
So here's what that actually looks like in practice. It's a human-led, machine-assisted model. Step 1, the human clinician is always in charge. They bring the judgment, the responsibility, the empathy, all the stuff a machine can't do. Step 2, the AI works alongside them, in the background, crunching data, spotting patterns, and offering support. And what's the result? Step 3, you get better, safer, more informed decisions. And maybe the best part? It frees up the doctor from endless paperwork so they can spend more time doing what matters most, actually talking with their patient.
Okay, pillar number 3. And this one tackles what for many people is the most infuriating part of the entire system, prescription drugs. The way we invent, price, and sell medicine is, to put it mildly, broken. And it all starts with a question we don't ask enough. Who's actually paying for the initial breakthrough science? Just take a look at this number. Over $300 billion. That's how much the NIH, the National Institutes of Health, funded by you, the taxpayer, has invested in the basic research that leads to new drugs. So the public, we, are a massive silent investor in almost every major medical breakthrough. And that's what leads to this absolutely maddening problem. We, the public, pay for it the first time with our tax dollars that fund that essential, groundbreaking research. Then, a private company takes that research, turns it into a drug, patents it, and then sells it back to us, the public, at outrageous monopoly prices. We're forced to pay a second time for something we helped create. The point here is simple. Scientific knowledge that was generated for the public good, with public money, shouldn't be turned around and held for ransom. All right, on to our 4th and final pillar. And this one requires a real shift in how we even think about what health means. Because any system that treats your mind and your body like they're two totally separate things isn't just inefficient, it's just plain wrong. Integrating mental health care right into your regular doctor's visit, into primary care, isn't some nice little add-on. It is absolutely essential. And there are so many reasons why. I mean, look at this. It dramatically improves access for people who need help. It helps break down the stigma, it lets doctors spot problems way earlier, but maybe most importantly, it finally acknowledges a basic human truth. Your mental health and your physical health are completely intertwined. You can't fix one without thinking about the other. You just can't slice up a human being into separate, billable parts that are convenient for an insurance company. It doesn't work that way. Okay, let's pull all these threads together. We've laid out the blueprint. We've seen the 4 pillars. We have a pretty clear picture of what a smarter, more humane system could actually look like. So that leaves us with the billion-dollar question, right? If we know how to do it, what's stopping us? And here's the real takeaway from all of this. The biggest obstacles in our way, they aren't technical. They're not scientific. We have the knowledge. We have the data. We know what works in other places. No, the real barriers are, first, a deeply flawed design philosophy, the fact that we've accepted a system built to prioritize profit over health. And second, it's a simple lack of political will to stand up and demand that we change it. So I want to leave you with this final thought, this quote. To put a price tag on survival is to confuse civilization with commerce. Health is the starting line, not the finish line. Think about that. A truly civilized, humane society shouldn't force its people to buy back their own chance at survival. Health isn't a luxury item. It's not a product to be bought and sold on the market. It's the starting line. It's the absolute foundation for everything else we claim to value: freedom, dignity, opportunity. So the real question for all of us is, are we finally ready to build a system that actually treats it that way?